Now that we have reviewed what diabetes is and how to lower the risk in the first video titled Diabetes Urine Control, let's talk about what to be aware of if you have already been diagnosed. Diabetes is a long-term, complicated, and demanding disease. A normal and expected part of having diabetes is feeling stress, frustration, anxiety, or even depression. It takes time to adjust to this new reality. Feeling anxious about treatments and outcomes is normal. Many people who are newly diagnosed with diabetes say they experience a roller coaster of emotions. Seeking additional resources like this short video can provide some support and reinforce the importance of taking care of your diabetes. It is very important to stay diligent with your diabetes management and ask for help when needed. When it comes to how diabetes affects your health and your life, you're the one in charge. Set yourself up for success by identifying who needs to be involved in your care. Diabetes care partners include doctors who specialize in treating diabetes, nurses, dietitians, mental health counselors, and many more. Take diabetes seriously. You may have heard people say they have a touch of diabetes or that their sugar is a little high. These words suggest that diabetes is not a serious disease. That is not correct. Diabetes is serious, but you can learn to manage it. Talk to your healthcare team about how to manage your A1C, blood pressure, and cholesterol, also known as your diabetes ABCs. This can help lower your chances of having a heart attack, stroke, or other diabetes problems. Let's review in detail what diabetes ABCs mean. A is for the A1C test. The A1C is a blood test that measures your average blood sugar level over the past 3 months. It is different from the blood sugar checks you do each day. It is important to know your blood sugar levels over time. You don't want those numbers to get too high. High levels of your blood sugar can harm your heart, blood vessels, kidneys, feet, and eyes. The A1C goal for many people with diabetes is below 7. It may be different for you, so it is best to communicate what your goal should be with your physician. B is for blood pressure. Blood pressure is the force of your blood against the wall of your blood vessels. Why is this important? If your blood pressure gets too high, it makes your heart work too hard. It can cause a heart attack, stroke, and damage your kidneys and eyes. The blood pressure goal for most people with diabetes is below 140/90. This may be different for you, so be sure to ask your physician what the right goal for you should be. C is for cholesterol. There are 2 kinds of cholesterol in your blood, LDL and HDL. LDL, or the bad cholesterol, can build up and clog your blood vessels. It can cause a heart attack or a stroke. HDL, or the good cholesterol, helps remove the bad cholesterol from your blood vessels. Ask your physician what your cholesterol number should be. Your goals may be different from other people. Don't be afraid to ask questions. Remember, you will always be the greatest advocate for your own health. Ask your healthcare team what your A1C, blood pressure, and cholesterol numbers are and what they should be. Your ABC goals will depend on how long you have had diabetes, other health problems, and how hard it is to manage your diabetes. Another important question to ask is, what can you do to reach your ABC goals? Lastly, it's important to stay on top of your medications, appointments, or any other routine care. Treat any symptoms that you are having early on. Here are a few tips of what to check for and how often. For example, at each visit, be sure you have a blood pressure check your feet and your weight, and review your self-care plan with your physician. Do an A1C test at least twice a year. And at least once a year, be sure you have a cholesterol test, complete foot exam, dental exam to check your teeth and gums, dilated eye exam to check for eye problems, flu shot, and a urine and blood test to check for kidney problems. We hope you found these tips helpful. As you can see, managing diabetes is serious but doable. This video was provided to you by the Health and Nutrition County Agent in Dickinson County. Please feel free to contact your local extension agent for more resources. Not sure who that is? Go to ksre.kstate.edu and search County Extension Offices to see where your local county office is located.